Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Hi, everyone, and welcome back to another episode of the Skin Sync podcast. This is Bucci Nita.
And I'm Shannon Moranti.
And we're happy to have you here with us again to talk about Would You Rather. So we had so much fun doing this episode a while back. We decided to do it again. So we'll talk about a few patients' case scenarios in the clinic, and we'll go over what would you do. So Shannon, go ahead and get us started.
Bucci, this was so much fun the last time we played Would You Rather. I think we got to know each other a little bit better. It was fun to kind of learn each other's treatment preferences. So I came up with some doozies for you, my friend.
All right,
I hope you are ready.
I'm a little nervous, but let's go ahead.
So let's get started. Would you rather peek into your waiting room and see a packed house? Standing room only. Patients are getting grouchy. The waiting room is filled. We're all running behind. But yet you know that waiting room is stacked with people who need you. Or would you rather see a ghost town, silent waiting room out there? Which one is more scary to you?
I will say at this phase in my career, Shanna, I will take ghost town. My MAs know this too, and they kind of gauge my mood for the day, but there are some days I'm rearing to go. Let's do this. Let's double book. Let's add those patients on. But I do find that lately I just kind of want a more quiet and subdued schedule. Just a night. Yeah, it's just sometimes it gets overwhelming. I do feel like my patient load, even if it's the same number of patients per day, I feel like their needs are greater. I feel like they have more questions. I feel like there's more conversations and counseling. And so I'd actually rather have, fewer patients and be able to spend that extra time than to have a jam-packed room of patients who are angry with me and I've got to apologize in every room. But yeah, how about you? What would you do?
It so rarely happens that we have a ghost town out front,
This is true.
Right?
That part, yes.
Right. But I think, honestly, I would rather the packed house because I am a master juggler. I thrive on chaos.
I don't know how you do it,
Mother
girl.
of four. I do way too much. I am the, constant complicator and try to be an overachiever. So I love the excitement of having a packed house that I know I can help. And that honestly fuels me to be more efficient, to go faster, not faster in a bad way, but work through problems more efficiently. Sit and take time and ask about their, family vacation as I'm examining them, and not just sit back and relax. So it kind of keeps me on my toes a little bit. So I actually prefer the packed house.
Yeah, girl, my nerves are bad. I can't do it. So I have my days,
definitely
but
think
yes.
There's going to be audience members that are definitely on the Bucci side of this argument and definitely on the Shanna side of this argument.
So,
all right, next one.
let's
What do you got for me?
You have a new patient sitting in front of you. Would you rather have a patient who you're initiating a new biologic or maybe even a JAK inhibitor for psoriasis or chronic atopic dermatitis? Or would you rather do the Accutane counseling for your teenage patient with the reluctant mom sitting in the back of the room?
Ooh, these are both really good ones and can be really time sucks for our schedule, right? And they were probably double booked in a 10-minute slot, right? As a new patient that you have to review their entire history. Yes. So I am going to go with Accutane 1,000%
I knew
of the
you
time.
would, Shanna.
Although I love initiating biologics, although I love initiating JAK inhibitors, these medicines are life-changing and game-changing meds for our inflammatory disease. I feel like I have the Accutane, kind of mantra down. I can give that spiel. I can give that counseling in my sleep. I mean, you can literally, I can fall asleep mid-counseling session and wake up and still give the same talk.
Nice.
Right mid-sentence. So I feel like I can deliver that with my eyes closed. I know the protocol. My MAs know the protocol. They know exactly when to schedule. We have it down to a science. Thanks to some fun Accutane hacks, which we should make into another podcast episode. But
yes.
I'm going to choose the Accutane. How about you?
I'm with you. So again, I love biologics. I write a ton of JAKs, but There's something about that Accutane visit that's just so satisfying to me. I had one today and he had horrific cystic nodular, almost acne conglobata, and I was in there for no less than 25 minutes, and I was great. I felt great about it. Because I think the thing with Accutane is that it's actually pretty predictable. So even if I have a patient with severe cystic acne, deep comedonal acne, I can pretty much talk them through what's going to happen next. And I don't have any real safety concerns. We go through the counseling. Patients respond beautifully. They're grateful at the end. I know that we're going to get clear skin. It's not as much of a question mark. So I definitely love an Accutane counseling session. It gets me excited. So
for those providers out there that are somewhat, thwarted by the iPledge system, don't be scared. It's worth it.
no, it's totally worth it. Totally worth it.
Okay, next up, treatment negotiations. You and I are both huge fans of shared decision making. We're both very passionate about our patients having a say and not just dictating their, what we recommend, but actually having the patients be part of the conversation. However, sometimes we have some difficult treatment negotiations. So would you rather have this talk with a preteen or teenager, and have to talk them out of their $200 Sephora, Ulta, or Target, skincare regimen that has 47 products, and they're all their favorite. They can't give any of them up. They want to keep doing all of them.
Of course.
Plus also take whatever you want to give them for their acne. Would you rather have that conversation with that very stubborn teenager? Or would you rather have the conversation with a very stubborn adult and convincing a skin cancer patient that their biopsy really did not remove the entire basal cell? And yes, they do actually need that Mohs surgery. Those are both tough conversations, especially when we want to involve our patients in shared decision making. So which conversation would you rather have?
I'm going to take the older patient with the skin cancer, and here's why. So I feel like my teen patients, that prefrontal cortex, it's just not fully developed. They're not working with logic and reason sometimes. And it's just harder to talk them out of things, I feel. And I have patients where we go through the whole conversation. We recommend some gentler skincare products, things that are simple and inexpensive. And they come back in 6 weeks with another bag full of just, what did you do? What is this? So very frustrating. I feel like it's a very repetitive conversation. And with social media influencing our patients, I find it just much more difficult to get them to be on our side and kind of listen to our medical guidance as opposed to what they're hearing on social media. So I do find that my patients who have skin cancers, I feel like it's a fairly easy explanation. I tell them that you have this lesion. We're seeing kind of like a, iceberg. We use that analogy. Or I'll usually say that it has roots. We remove the surface of it, but it's got these roots. And if we don't get the roots out, it's likely going to come back and it may cause some pretty significant damage. Once they hear that, I think they're pretty much on board. In the few cases where I'm unable to convince them, we watch them closely. I tell them I need you back every 6 months. We're going to monitor for any recurrence. But I usually can get them on board. And we have fabulous Mohs surgeons with our clinic. Where I'm confident of the results that they're going to get. So I think that's my patient. How about you?
So, although I 1,000% agree with you with the skin cancer patients, I have so many patients that are surgically fatigued and they love our Mohs surgeon. I mean, he is one of the sweetest human beings. We actually have multiple Mohs surgeons in our practice, but the one that I refer to the most is lovely and is so fantastic, and patients love him. But sometimes they are just so tired
of having
treatments. So I like the challenge of taking on the teenager. Maybe it's because I speak teen, because I have a few of those at home, and I want to get into their brain that less is more. Stop all the stuff that you're doing, because I use the slime analogy. Like, if you put everything into a bowl like you did when you made slime a couple years ago and mix it all up and then put it on your face, how are you to know if the glitter or the add-ins or the borax solution or the whatever is the one actually irritating your skin? You don't know, because these products have not been tested together. I'm going to give you a regimen that actually has FDA approved, treatment success, and will give you some simple solutions. So I like to say, let's like break it down, make it simple. And I like them to literally throw that Sephora baggie, and I don't just want to, pick on Sephora because my girls love Sephora, but I do want them to kind of step away from the very complex social media, kind of induced skincare lines and get to the bottom of the problem.
Shanna, you're a strong woman. I don't know how you do it, but I
like a
respect
challenge.
it.
I like a challenge.
I respect it. Okay, so next question I have. So you have a patient that comes and let's say maybe they have atopic dermatitis. They've had it for years. They've seen all the derms and they come in with their bag full of products and you've got to go one by one and pick up every slimy tube. To figure out, okay, well, you had Desonide here and clobetasol there and triamcinolone there and work through all these products that they've used previously.
So are they bringing in like the grocery store
bag, messy,
like
greasy,
their pharmacy graveyard, I call
Yes.
it, like everybody has a pharmacy graveyard.
Or the Ziploc
Within
bag.
the
Yes.
Ziploc, yeah.
Yes.
I actually appreciate a Ziploc because then we don't have to touch the slimy tubes. But no, how often, and like they're like, I don't even know, and everything's out of the box. Nothing
Yes.
has instructions. They don't remember, anything. However, we have the exact formulation of what they were actually using. So that is good
true.
information.
This is true.
Okay,
Option
I'm sorry.
option two is that you can go into your EMA and import their medications from the pharmacy and have clear medication names and percentages and formulations right there in the system. So what's the easiest option for you? I think they're both kind of challenging in different ways, but what do you think?
They really are, because in a perfect world, if we could import everything magically and if all the EMRs talk to each other, I think that would be fantastic because our MAs could do that work before we walked into the room and they could do that pharmacy import with the patient's permission and have all of the formulations very easily imported into our EMR. But as you know, and as I know, that is not, we don't live in a perfect world and they don't all magically talk to each other. So I actually like to physically see the bag. I don't always have to touch the bag or hold the bag.
Or you can glove up, right?
Or I like to see the picture. I'm like,
Yes.
line them all up on your counter and take a picture
Yes.
so that we can zoom in and know exactly what formulation, exactly what percentage. So I'll often have patients, especially if we are planning on trying to get them on a biologic, trying to get them on a systemic medication that we know we're going to have to go through a very difficult prior authorization process. I want to know exactly what their tried and faileds were.
For sure.
And I don't want them to have to remember because they won't remember names,
For sure.
So I do like the physical
like
bag,
the bag,
or at least a
okay.
picture.
Well, just a little warning, Shanna. I had a patient recently who brought in his bag of goodies, and he also happens to love essential oils and the natural peppermint and the, echinacea, whatever,
lovely.
eucalyptus.
Yes.
He had a bottle of oregano oil in his bag. It
Oh, boy.
spilled everywhere,
Oh,
all
boy.
over my room. And literally, we cleaned it, alcoholed, sanitized. It smelled like oregano in my pod for at least the week, like 7 days, a full week. I still have nightmares about it. It was so terrible. So hopefully
So
your
you
patient
don't
doesn't
use
bring.
oregano in your
I do
cooking
not use
anymore, I'm
oregano in my
assuming?
cooking. It makes my heart flutter. It just I don't. Yeah, no. I still have memories of that. So hopefully your
gosh,
patients
oh,
don't do
gosh.
that to you. So
Yeah, no
some, kind of related to this. I have patients who come in and maybe they're not doing prescription therapies, but they have skincare products, right? And
Yeah.
they bought it from Amazon and maybe they went to TJ Maxx and picked up this vitamin C serum and they want to know, what should I use? What do you recommend? So now you've got to go through these products. Sometimes the box isn't in there. You don't know what the ingredient is. What's your approach? What do you do in that situation?
So tough because, again, formulations are so important. And just because they have a rock star ingredient, they could have terrible preservatives and a terrible formulation and a terrible vehicle. If it's an oil-based comedogenic vehicle and they're acne prone, I don't care what that active ingredient is. I don't want that going anywhere near their face. If it's essential oil or not essential oil, I don't want any oil on their face.
Yes, 100%.
So, natural or not natural, not all products are made for all skin conditions. So I really, really love to stick to evidence-based medicine. So I oftentimes will really try to talk them out of those products. And if they come in with like an entire thing, I'm like, entire baggie, I just say pick your favorite one. Like, let's start with one. And you can add one as long as it's not an egregious project, as long as it's not something that I think will make their condition worse. Pick your favorite one and then try my regimen. And you can add, you can use your favorite one, your little lovey, your little security blanket, but let's try to transition. Obviously, they came to you because what they're doing is not working.
Exactly.
So we need to make a change. So I kind of lean into that a little bit and try to get them away from a lot of these products because it's really terrifying what actually can be in products these days, and we just don't know.
Yeah, and I think, and you have to ask questions too. I had a patient today. She has CCCA, and she's actually doing pretty well with that. But she came in with awful sebderm, and she'd never had sebderm before. I'm like, what is this? And she's like, well, I've been using this product I bought online, and we look at the ingredients, and it's got 5 different oils and beeswax and all kinds of things. I'm like, this is causing your issues. Stop using this. And so now we've created a new problem that we've got to now try to correct. So ask the questions, investigate. Patients, they're not always forthcoming, but sometimes you'll find out things that are really relevant to their condition, right? So
that is really helpful information. You're absolutely right. Okay, I've got a real doozy for you.
Uh-oh.
And I think this one is going to resonate differently with different providers depending upon their subspecialties. I think that, there's going to be a very clear line dividing surgical PAs versus cosmetic PAs with this one. So, would you rather get the dreaded call from your answering service about and by the way, this is over a holiday.
Of course it is.
When the office is closed.
Of course
So
it is.
the answer is I would not want either of these calls, Shanna. I know. But would you rather get that call from the answering service about an expanding hematoma in a beautifully closed wound that you probably had a hand in closing and you were so proud of that closure and it looked so beautiful, but now it is bleeding and oozing and expanding and you're going to have to open that entire thing up and find that bleeder and do a pretty extensive, kind of repair later? Or would you rather get a phone call from a filler patient that calls with grave concerns that her entire nose and cheek has gone pale and is feeling very cold, and you are having nightmares about the vascular occlusion that is happening in her face at the moment?
Shanna, this is scary. Why are we doing this?
This is reality. Like, people listening to this call have had those exact calls from the answer
This is
service.
why I do general derm exclusively.
And both of these scenarios are awful. Let's be honest.
This is
They're
true.
both terrifying.
This is true. Okay, so I definitely would choose the surgical patient. Filler terrifies me. I've dabbled in it here and there over the years, but that's a really scary situation. And to me, having necrosis and potential, travel and blindness, it's frightening. So I feel like I have more of a grasp of the surgical situation. I think we can drain the hematoma, find the bleeder, deal with it later. Maybe the scar's not great, but at least I feel like we can manage that okay. The filler patient, that really does scare me, and especially the face, right? We've got potential for permanent damage. Yeah, I don't want that problem. How about
Vascular occlusions are terrifying and can happen to the best cosmetic injectors. Right. And the more injections and the more procedures you do, the more likely you are to have one. And isn't that the case in life, right? Like, we all feel like we're good at what we do, and we get into the groove, and you get more confident. And there are some amazing dermatology PAs and nurse practitioners that I've seen give lectures on how to handle a VO. The FSDPA has done a beautiful lecture series on how to handle it. It even detailed like what to have in your emergency kit in your office. There is not enough hyaluronidase in the world, that you're going to want to stock after you hear these lectures. But I'm with you. I was, very confidently surgically trained by fantastic Mohs surgeons. I did Mohs closures for 10 to 15 years. And I've gotten that exact call over at a holiday weekend when I was taking call because I was the only one in town. And it's very scary to have to open something back up and find that bleeder. But I'm with you. I think I would take that surgical case and just chalk it up to that poor patient does not want to go to the emergency department or the urgent care, or maybe they were already there for a number of hours and they are still bleeding. They need someone who's confident in the surgical prowess to be able to get in there and find that. So I'm going to choose that expanding hematoma. So kudos to all of the cosmetic PAs and nurse practitioners
Yes.
out there that can handle and confidently can handle the vascular occlusions of the world, because those are pretty scary. So this is your, reminder to brush up on all of those protocols.
This is true. Well, on that
how to
note,
handle those
Shanna,
emergencies.
on that note, now that you've terrified me, I think that's a good time for us to close out this conversation. So, any final tips or words from you?
Again, go in confidently and don't let fear be your guide. Make sure you are properly trained. Make sure you know who to call for backup. Make sure you know when to phone a friend. None of us practice in a vacuum, and it's so incredibly important to have a good support system, because even the best trained surgeons in the world have adverse outcomes, and even the best cosmetically trained providers can have a vascular occlusion. So on that note, everyone needs to go home and review their emergency protocols. And stay tuned for future episodes of the Skin Sync podcast. It's been such a pleasure. Thank you so much for spending some time, and I hope we all learned a lot tonight.
Great.
Thanks for tuning in to Skin Sync. Don't forget to subscribe to Skin Sync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.